we'll do that later. We'll do that. We can use this later. Okay. See, the funny thing is, if you have that little heart, and a part of it, someone must have thrown a part of it away. The part of it's missing. David, you're not going to find it. Daniel, you're not going to find it. David, didn't I? Yeah, that's all I have. The funny thing is, for a long time, the technician, before, not the one we have now, kept it in the back room because she didn't want the students to mess with it. Oh yeah. 50 years from now, 50 years from now, we'll have a perfect heart that nobody's seen. Yeah. You know? Hello. But of course, we pull it out, and what happens, we lose part of it. Okay? So, this would fit in here someplace. Okay. So this is the thoracic aorta, abdominal aorta. First branches are the celiac trunk. Okay, so we have the common hepatic artery, a left gastric and splenic artery. Then the superior mesenteric, inferior mesenteric. Then it branches into the common iliac arteries. Internal iliac.
External.
And external. The external becomes the femoral artery. Okay. And of course we have the renal arteries and renal veins.
Got it.
This is the subclavian. Subclavian internal jugulars to form the brachiocephalic.
Nice.
So that's about it there, I guess. Okay. So we take this away if you want. Oh, someone take it away. Anything. This is an enlarged heart.
That's what happens when you go supersizing it.
Yeah, okay.
That's such a big heart.
So this is the brachiocephalic veins that join to become the superior vena cava. What would this be?
Right atrium. Wait.
Well, it's sort of
it's the
little green thing. What's this supposed to be?
No, SA node.
SA node, right. This is the
Pacemaker.
right atrium, the right
Pacemaker.
auricle, left auricle. And here's, so we have the inferior vena cava coming in, superior vena cava coming in, and that hole is supposed to be the opening for the coronary sinus. And the depression would be the fossa valis. And this little green thing would be the AV node.
AV node, tricuspid valve.
And then the tricuspid valve. The three papillary muscles with the chordae tympani. These muscle fibers are the
trabeculae.
Yeah, that's a different thing. Okay. You have the atrial septum and interventricular septum.
Interventricular septum.
Okay. This would be the pulmonary trunk going off right here.
Pulmonary trunk.
To the right and left
pulmonary artery. Artery.
And the ligamentum arteriosum. Coming back.
Pulmonary vein.
Or pulmonary veins coming back, okay? To
left
the
atrium.
Left atrium. Let me get a little piece of tape off. Not the tape all over this. That's the 120. They like to tape up everything.
We should tape up everything too.
If you want. Take them off before the test set up. It's so annoying when I'm getting the test set up. Left atrium through the
mitral valve.
Mitral valve, also called the
bicuspid.
Bicuspid, also called the
left AV.
Left AV. And they made it look wrong. They made it look like a tricuspid instead. So watch out for that.
Yeah, I was looking at this.
Yeah, she only had two papillary. And these trabecular carni should be larger here, and the wall should be thicker.
Thicker.
Then we go out at an angle through the aortic semilunar valve. Notice the first branches. Right coronary artery and left coronary artery. This is the ascending aorta. This is the
trunk.
No,
aortic arch. Sorry.
Aortic arch. This is the
brachiocephalic trunk.
Left common carotid.
Left subclavian.
And then the thoracic.
Descending.
Descending.
ABCs.
Okay. Now let's look at what's the lining called?
What lining?
Of the heart. We're talking about the heart. Endothelium, or also called the endocardium.
Endocardium.
Okay. And the muscle is the
myocardium.
And on the outside we have the
pericardium.
Epicardium. Or the
visceral
layer of the serous pericardium. And this is the
Coronary.
Right coronary artery with the marginal branch. Okay. Comes all the way around the back to become the what? Posterior. That makes sense, right? Interventricular artery. Okay. And it feeds the posterior part, especially the right ventricle, but also some of the septum, I read. And the left coronary artery branches pretty fast into the circumflex, which is feeding the left side of the heart. And this one here, this was affected in the video. Left anterior descending, LAD, or anterior interventricular artery, or Widowmaker.
Game over on that one.
Yeah, so that's a bad one too, because it feeds both ventricles and some of the septum. But it depends upon the person. There's a lot of variations. Okay. What are these called again? Auricles.
Oracles.
And lots of fat. And the coronary sulcus goes around here, interventricular sulcus. Anterior and posterior. That's about it on this. Okay?
The trachea.
And the trachea back there. Okay?